Sometimes the patient have only the
Localized, yeah.
clitoral part, they have the.
If it's localized, it will respond better than if it's
Generalized too much.
Generalized. Localized respond better than.
And removal of small warts and all that is something that's
I
the
didn't mention
easiest
this.
thing.
There's a surgical handpiece to this.
There is
machine.
another handpiece which can just burn the
Burn
warts.
the warts. You can also use it for labiaplasty or etc. It cuts and coagulates at the same time. You can use it as a knife instead of diaphragm, radiofrequency or scalpel. It's an excellent tool. But I spoke about the outpatient solution.
So this is was
But if
outpatient, but you
you're-
could do other operative procedures, different handpieces. So for cutting, coagulating, burning the warts,
You
cutting
can
the warts.
attach this machine to a colposcope and to do colposcopy.
Cervical biopsies, cervical conization. We can use the same through the laparoscope for laparoscopy, endometriosis fulguration, endometriosis cutting, cyst, all that fibroid. So it's a very versatile machine. CO2 lasers in gynae is what is needed. Except for tattoo removal, where there is
Tattoo removal? That's a different type
that's a different type of CO2 laser. Hair removal is a different type of CO2 laser. So those are there, but those are different. Really, couple of things which this technology
You
cannot
can
do. I
remove
think
warts
so.
from
That's it.
ENT warts as well.
Yeah,
from the
this
larynx.
you can use in ENT also. ENT warts, throat warts inside the ear. So the ENT people also use it. And a lot of skin specialists use it,
Dermatology and plastic.
facial, laser facials, removal of warts on your the spots on the skin, face, anything, all that. We just showed hands-on to all of you who came in early on removal of warts on my IT technician hand, and a lot of you did try to do. So we just did it just now from skin, hand, skin. So the same your different recurrence in water, stress incontinence, or prolapse.
Recurrence in the prolapse.
See, that is where the case selection is important. If you have 3 or 4 degree prolapse,
Even if it's a
coming out.
recurrent,
Early stages like first degree where surgery we are not doing and we are not advising only Kegel exercises we advise.
A lot of people do know first degree prolapse, family
Yeah,
completed vaginal hysterectomy.
Not those kind of cases only in early prolapse stages if we are doing it.
Yeah.
What is the chances of recurrence?
again, some patients regarding stress and prolapse, they need to reboost after 12 to 18 months. But again, you don't be afraid from that because it's an outpatient procedure. It's not like you did an operation for a prolapse or stress incontinence and you need to repeat it. She doesn't need to be admitted, no anesthesia. It's a short procedure, so don't be afraid if you have to repeat it. It's a short procedure. Don't be afraid for need to repeat it.
What I was asking is, if when we do a surgery for repair, a lot of people do only cystocele, rectocele, or a Fothergill, and that recurs, can we use laser here?
Yes.
So instead of doing a repeat surgery, this is where
it's not contraindication.
so if
previous
your
surgery is
Fothergill has failed, if your cystocele repair has failed, then you can use, instead of putting the patient into another surgery or a sling or complicated surgery, that is where we can use it.
Yeah, definitely.
So
Yes. Vol prolapse less. It's
Vol
more
prolapse-
cystocele,
vol prolapse is total
rectocele,
void, so
it's less.
you cannot do- you
For
cannot
apical
do-
prolapse, it won't support. Apical prolapse, it won't
So
be.
there is no ligaments, it will just tighten the ligaments. So Dr. Ronan and me are going into the OT. Dr. Leela Vyas, I'll ask you to join here. Dr. Leela Vyas, Professor Leela Vyas is from
I
Jaipur.
want to emphasize, it's done in the OD, but it should be done
Anyway.
in the office procedure. not
Actually, we made a laser room just outside the OT, so it's not exactly the OT.
All in the traumatic means luxation of introitus, that is sometimes what the perineal tears occur during the delivery. Then what is the role of this in traumatic? Because already the first degree or second degree perineal tear is there.
That you have to stitch.
Then
No.
it will work or not?
The operator won't repair, but patients with tears that perineatals that have pain, localized pain in those areas, and it can help them for that point.
Third degree tear, you have to repair it again, but
Yes.
it will only tighten that
itself, no.
area a little bit.
The tear itself, it won't repair.
Patients, they have old tears. They are coming with that, they had delivery, old deliveries, or the sometimes.
Those are healed very badly and all.
Those are healed very badly. You can
You'll just tighten them, I think, with the
Could we just
It's not correct them, but if they have pain, that not, the issue is not correcting the aesthetically, but they have localized pain in this area, it's very helpful.
Most of the time they are feeling laxity rather than pain.
It will improve.
It will improve.
But
no?
Laxity will improve.
Without tear, then it is too late.
No,
But if
laxity
it
with
is
the
because
tears,
most
old
other
tears,
patients are
those
there,
are not repaired.
at least they will feel better.
It helps. In area, yes, it helps them because it restores new blood vessel, new fibroblast activity, yes. Yeah.
There's a best.
Scar removal, keloid removal, warts removal, pigmented areas removal,
Yeah.
all that. Try-off if they are fresh try-off.
Fresh is there.
Fresh. Pregnancy mark removal.
Fresh, what do you mean by fresh? How old? Postpartumly. Extra gravidum.
I'm not a dermatologist, and that's you will ask. You have to ask the dermatologist because I'm not.
Any one of you can tell us? Is it being used for
Extra
remove
It used. I know
pregnancy
it's
stress?
used. It used.
How fresh? What do you mean by fresh
I-
postpartumly?
My friends, I'm not a dermatologist, they said wait 6 months after deliveries and then start to treat because there are changes, hormonal changes, but
6 months.
they are better, they have the better knowledge of treating that.
What? If the hanging abdomen, too much fat, it's a big area. I don't think.
You have a liposuction with laser as well, you can do it.
The area is too large to do it.
Yes.
Device. Okay, we have what we call Femitite, the same.
So you have a probe for
Tummy-tight.
skin tightening.
It is called Femitite.
Anywhere, facial skin tightening, abdomen.
Yeah, it's a defocused probe,
But
so it doesn't ablate the skin. It just produces.
हेलो
एक मिनट रुको हो गया
कैमरा ऑन
एक मिनट ओके
ओके ओके
यस
So here we are. Can you see the pictures and can you see the hello machine? We are just showing you the machine, and he's just. It's an OPD procedure. We're doing it here because of the patient. So she's not. She's comfortable, so we just close it. Otherwise, nothing is required.
Hello.
Yeah. Yes. Can you hear us?
Yes, yes, sir.
We can hear. So, any questions, anything extra you want to ask, we start here. So,
Okay, what
Dr. Ra-
patient you have taken? Just sir, tell us the history of patient. Hello.
yes, this
Detail
is
of the patient.
this patient is 50 years old and she has trophic vaginitis and also mild cystocele, and she is the perfect candidate for this kind of treatment. Today we will show this is the FemiSmart probe. This is the robotic probe that does the pulling and rotating of the probe by itself. You don't need to handle with rotating and pulling. It does itself, as I will show you very shortly. It's very convenient to the doctors to use this machine because it does all the work by itself. Here it's done in semi-OD settings, but you don't need to cover the patients. You don't need any of the settings. It's an office procedure. She comes, going on the stirrups, and that's it. In most of the cases, I recommend the patients to have phones in their hand that they will play during the session. It helps them to pass the time. So
So here we have two cases for demo, and so this is no need of all this, but because of a workshop, we're just doing it so the patients are more comfortable with it. Otherwise, we just do it in the OPD, where we do a per speculum examination and everything, and that's it. So this one is not the one which you saw, sir. Don, and this is the other one. Yeah. So first thing is
The most important thing before we start is to inspect the vagina thoroughly to rule out any infections, any abnormalities in the cervix, any bleeding.
So you are not audible in the hall.
hello, hello.
Hello, you are not yeah.
You hear me?
Yes, sir.
Now, it's very important to check thoroughly the vagina before we test. And if you want, we can also, you can see the pictures inside the vagina. If the camera will go.
So focus is not proper, sir. Too bright, sir.
Okay.
It's not visible properly, sir.
And
It's
see
not
the-
visible, not audible.
Here. You can picture the vagina before
It's
and
not-
after the treatment.
Not audible, sir.
See, what we have is a small light in the this thing, and like a colposcope, this is a small probe, and it's put on, like on the colposcope mode right now. So you see inside, you see the vagina,
Yeah.
you see the atrophic vagina, you see it's atrophic vaginitis, which is not getting treated by any antibiotics and anything. So this patient we're going to try this out. But she's absolutely in terrible itching and terrible pain always. I've tried everything. So let's see what we can do here.
This is the very smart probe. We take out the protector, and this is the cover. It's not for use. We need to use. Where's the cover? No. This one. This one. Yeah, you can open.
So you saw the protector of the probe, this is the probe which shoots the laser. Then we have various sizes of these disposable things, and he's chosen the right size, and we just fit it over the laser.
Now it's very important to ensure that the window is right across the lens, because otherwise we don't transfer directly the beam of the laser. So it's very important to ensure that the windows is above the lens. And then we put the protector. Then we touch, and
So
then we
please
see.
tell the procedure.
And now you can see on the monitor, it's very
So please
self-explanatory.
tell, it's not audible, sir.
It's self-explanatory. You can see on the manual screen what you have to do. We put all the valve, press done, we attach a sleeve and push the back button. Now it's done. Now we have to set the settings. First, if we want to do only the upper part or doing 360 degrees, I recommend that even if you're doing only for stress incontinence, do 360 degrees. Don't settle up only for the upper part, because from my experience, you get much better results if you do 360 degrees, not just the upper part. So I choose rotating 360 degrees. You choose the speed. You can choose the slower, faster. Usually choose in the middle, because if you choose faster, it gets warm sometimes. And then you choose the level of the energy that you want.
So what is the criteria choosing energy? How much energy?
Experience. We start, and then you can increase.
Okay.
There are two separate levels of energy. One is to the vagina itself. And one is to introitus. The reason is the introitus, it's much more innervated and more sensitive. That's why we use less energy in the introitus area. And the machine now itself, when it reaches the introitus, it decreases automatically the level of energy. Now it's done. Now we press set, as you can see. It's very self-explanatory.
So after setting the machine, it just prompts you how to set. Then you introduce it into the vagina.
Okay, so you are inserting in the vagina.
Yeah, like a vaginal probe.
Okay.
Now we're starting to progress.
The outer sheet will not let it go too much in. Bas.
We need to reach posterior fornix.
So then you advance. It will go to the posterior fornix. When it touches, it will stop there, or you will get a feeling.
And then if we reach, we press set. Need to open the shutter behind. Okay.
So once you reach the introitus, then we will come out 1 centimeter by 1 centimeter and fire the laser circularly all out.
Okay.
Now we are lacing.
We will withdraw slowly.
No, the probe will withdraw inside.
Okay.
Inside,
Okay.
and you see the retraction.
You see the probe is now rotating slowly. Can you see that?
Yeah.
So that is, it is firing laser around at that level. So when it comes 360 degrees, then it will come out 1 centimeter by itself. And then it fires, then 1 centimeter more. When it reaches the introitus, the power will automatically decrease to 25. Now here she is tolerating a power of 70. So no need to decrease it. If she feels pinching and everything, then we decrease the power.
Now it goes on to the introitus and then going back again, the fourth, at least 3 times. This is the basic. I recommend to do 4 to... Now you see they finished the first pass, now it's going inside again. This is the second pass.
Okay.
And you see it's very easy to handle. You just need to keep the probe right in the vagina, touching the vaginal wall. Yeah. Thank you. And it does by itself all the work of rotating, pulling outward and inward.
So people are asking, you have used any lubrication?
It depends. If it's very atrophic and very dry, I use baby oil.
Sorry?
If it's very, very
Okay.
dry,
Okay.
or very narrow vagina, use baby oil amount. Don't use water because it will interfere with the laser beam. And now it's reaching to the posterior fornix. And now it's going
So first it came out from the posterior, then gone in, then come out, then go in once. So 3 cycles in about 8 minutes.
And this is the basic free session, but I recommend to do it 5 because you get better results. If you do it more lasing the vagina, you get better results than doing less laser beams. Also, higher the energy that the patient will suffer, better results that you will have. You should always aim to the high energy level that the patient can tolerate. You can see we're reaching the end.
So see the light, once you see the light, now she feels a little bit. So we reduce the introitus energy from 25 to 19, 18 or 20.
Okay.
See, we've reduced that energy to 19, you saw? Because she felt a little bit pain at the introitus.
So not audible, sir? Not
Rest of the vagina she's not felt pain. Only at the introitus she felt a little pain, so we reduced that energy.
Okay.
This is the most innervated area, the introitus, so we need to use less energy. And this is the 4th passage, and then will be the last 5th passage.
So this is the 4th time we are doing, and then 1 more pass. So we are following the 5 passage protocol here.
Personally, I found that the more laser beams that you shoot, the better results that you will have. Don't settle only for free.
Now because this one is for atrophic vaginitis, probably she'll need only 1 sitting, or maybe if it recurs, 1 more after a month. The other cases which was stress incontinence too much, they follow the 3, 0 and 2 months.
So the patient will complain about her recurrence, or you will examine her?
No, obviously we'll do a pecklum exam. This one is coming to me since 1 year with itching, chronic itching. So I'm hoping that she'll not come to me again.
Okay.
She will come to you with flowers.
Or she'll come and bring me a bouquet of flowers.
So did you do any sterilization before using that?
Vagina is just clean, normally swabbed and clean, nothing else.
Any pre-medication? No.
No
Nothing.
pre-medication, nothing.
That's it.
And that's finished. The procedure is over.
Thank you. Congrats.
We'll do a per speculum examination after that again. PS. So normal PS, or you can put a camera in that and do a colposcopic PS. So you see those laser dots?
Yeah.
Can you see the dots on the
Yeah.
interior? Huh?
Yeah,
Those are where the laser holes are.
Yeah. Laser dots, yes. Very nicely appreciable, sir.
So it is white, but tomorrow, day after, 1 week, it will be blackish or reddish, and then heal off completely. So in 1 week, the healing will be there. Little bit of itching they might feel as a side effect tomorrow or day after 1 week.
Patient complained anything, sir?
Nothing. She did not. She only once at the detritus on the second pass,
So you
not on the
reduced
first pass.
energy.
So we reduced the energy. In third, fourth, fifth, she did not complain anything.
Okay. Suppose the patient complains any itching, so do we prescribe something?
Only just reassurance. Maybe some spring gel or some lube gel, so lubricant should be given to her, nothing else. And she goes home without any medication. She just gets up, walks up, and goes home.
Any post procedure, anything you want to
Nothing.
prescribe?
Only keep
Nothing.
clean area. Only hygiene has to be maintained.
Routine hygiene.
Oh, bus. That's it. निकाल दो यार. Till we get the patient, you can-
Can the patient use some
Any questions?
vaginal wash or gel?
Sorry? No need to anything. No antibiotics, no gel, no washing. Resume normal life activity. Nothing at all. Just tell her that she will experience mild discharge for 24, 48 hours, and that's it.
Sexual activity after how much time? Sex after how much time? She can go for sex.
Sex between 24, 48 hours. It depends if it was longer treatment, shorter treatment, but usually I recommend after the discharge will disappear, they can resume normal sexual activity.
After
The 24, 48 hours, they can resume
48
normal.
hours.
Yeah.
Okay, thank you.
So it's very simple. Just remember it's the settings that you will usually receive for this treatment.
She was a patient of non-specific itching in the vagina.
Yeah,
So you have given laser in whole vagina?
the whole of the vagina. I treat the whole of the vagina. Even if I treat pure stress incontinence with no laxity, no itchiness, no other reason, just stress incontinence, I treat the whole length and the whole 160 degrees of the vagina, not just the upper part. Because I found that if you treat the whole length and 360 degrees, you get much better results than doing just one part of the vagina. The only exception is localized vulvodynia or pain in the scars after delivery. Then I treat only the point of pain. But otherwise, I treat the whole length from 360 degrees.
Even in SUI you treat whole?
Even as well, you treat all length of the vagina. The results are much better than only treating the upper part.
So there is only one standard procedure which you have to follow in most of the conditions. That is, you just have to put the probe. It works by itself.
Yeah.
There is no specific
That's-
area you have to put.
It's
most
very
of-
easy, yeah. Yeah, one same procedure for most of the patients with the vagina probe. It's different if you use it for labral tightening, resurfacing, otherwise different
So
indications.
before you take patients of vaginal itching, do you need to rule out VIN1, VIN2?
I do colposcopy, vulvoscopy, we're doing STD labs examination, we do vaginal culture as well, yes, definitely.
Okay.
So yes, Amit, this case 1 year she's had all possible tests which are available for infection, for any viral anything, and not been able. So when she came just 3 days back, I said, okay, here is a chance. This is what I'm going to try. Otherwise, after this, you can go wherever you want.
So does vaginal itching has a proven treatment with laser?
Yes, that is what they are saying. That is why I am trying it here.
Okay.
Intractable vaginal itching, lichen sclerosis, vulval itching at the introitus, introitus itching, introitus pain, all these things.
How old is the patient? What is our pediatric history?
This one is 40 years old, I think. No, not this one, the previous one. 50.
50. So do you suspect estrogen deficiency? And
Yes, we have tried. 2014 say we are giving her estrogen. Local, oral, every possible treatment. देखो file. ये देखो, ये इधर देखो. Look at the file. To 2014 से है मेरे patient.
Okay.
Why she is sticking to me, I don't know.
Okay.
Maybe I think एक बार तेरे पास भी गई है. So we've not been able to, all Agra, we've not been able to treat her. So this is my hope. After that, she goes to Israel. So okay, here we have the second case, which is stress urinary incontinence.
Okay. This is a patient of SUI.
Yeah, pure SUI.
Is it demonstrable?
Yeah.
Is the bladder filled or empty? So I think all these procedures must be done when the bladder is empty, or it doesn't matter.
It's better to empty the bladder because it takes some time, and some patients feel in the middle that they need to go to pass urine. So it's better to empty the bladder spontaneously before the treatment, and it reduces the necessity to stop in the middle to go to the toilets. No other reason.
So
Speculum?
empty. So do you use this CO2 also for the G shot and the O shot?
No, it's not. Some patients feel more satisfaction because they feel more friction inside the vagina, but it's not related to orgasm. Just related to the sensation of friction, that they will have better friction.
The discharges to be cleaned? The vaginal discharge to be cleaned or? No, no.
It's not infective.
Okay, so again, we mount.
So you examine the vagina,
Yeah.
and is there any cystocele associated with SUI, or it is just
Very minimal.
Very
Very
minimal.
minimal cystocele. She's the perfect candidate. Minimal grade 1 minus cystocele and pure stress incontinence. She's the excellent candidate for that kind of a procedure.
Okay.
Again, we mount the single-use hygienic probe, make sure that the window is against the lens, and then we put the protector. It's very easy. And again, when we do it, we press down, and then we pull back the machine until it stops. If you forget what you need to do, everything is self-explanatory. Again, we choose 360 degrees pattern, the medium speed, and we'll increase.
What is this which you are pressing?
It's the energy that delivers to the vaginal canal. Now I increase it. I can increase and decrease in between if I find it that she can tolerate more or there's any comfort. So, and this is the energy to the introitus, and since the introitus is much more
The
sensitive,
first one is energy in the vagina, and second is energy in the introitus.
because the introitus is more innervated, more
Okay.
vulnerable to pain, so we use less degree of energy. So now
Okay.
we finish, we press down, as you can see. And now, if you don't remember what to do, it says to you, insert the probe to the vagina and sink the length of the vagina, and then press set. So you don't have to remember.
So how fast the patient Okay, you do the procedure, I'll ask the questions afterward.
So we advance the probe into the vagina until we reach the posterior fornix. And we press set. And now we start. I put the pedal, if you see there's a pedal down below, and as long as I push the pedal with my foot, the laser machine continues to rotate and pulling backward.
So
The
it
probe.
has started firing?
Already started.
Okay.
It started, as you can see, it
So
rotating.
first is, it goes in the anti-clockwise direction,
Yeah.
and then it goes in
And
the
then
clockwise
clockwise
direction?
Inside, yeah. You can see it lasing. As you can see, the patient doesn't feel any pain or discomfort. That's the beauty of the thing.
Okay.
She's very calm, no pain, no discomfort. And to the operator, it's easy.
How much time it takes to develop the response or the symptoms to go away?
Usually we start to see improvement between 30 to 40 days. That's the time that the remodeling starts to happen. So 30 to 40 days you start to see the improvement, and every session it builds up more and more.
So for 30 days you have to reassure the patient.
Yeah, definitely. Beginning from the set-go, I tell her, don't expect a miracle that after one day it will disappear. It takes time. All you need is patience. It will come. And if you choose the right patient, I can promise her that 85% of her symptoms will go away. And you see, I'm not doing anything, just pressing the pedal, and again. The patients feel slight discomfort, so I can decrease the energy levels
And next month and 1 year wala. So it will last for 1 year.
and
That's the
resume
fixed cost.
activity.
Rest procedure charge, which however you want to charge.
Right now, does she feel any
Some.
discomfort?
1 month. Result will start showing
Right.
at 30 days. So patient will start feeling better.
And you can see
That's a protocol.
there's
Zero,
increase
one,
of
two is the
secretion, as you
protocol.
can see on the probe itself.
Fixed protocol.
It produces increase in secretion of the vagina.
Patient
So
will
the
start
treatment
feeling relief
itself.
in 20 days. Some of them start feeling relief immediately because edema hota hai, immediate edema. So immediate edema, then 30 days pe the effect wanes off. So your second sitting comes, then she feels more relief. At day 40 she's feeling as if she's cured. So a lot of them drop out of the third sitting.
So,
that
again,
that
she
is it,
feels
because they
pain,
feel
so will
absolutely
decrease.
awesome. It's better you give the 3 sitting. Treatment 8,000 rupees ka disposable hai, which will last over 3 sitting. Baki it will depend on the doctor how much they want to charge.
You can see the
Cost
secretion
of
that
machine is 53 lakhs.
it produces, and that's
5.3.
how it helps women with vaginal atrophy.
So that depends. You'll do it for 5,000, I might do it for 2,000, 3,000 per sitting. So I think
It's very easy, as you can
karega
see.
for 5,000 per sitting to charge karega. So 5,000 per sitting and 8,000
Any
first.
recurring-
First 13,000 ho gaya. Next 5,000, next 5,000.
Recurring cost of the machine, any recurring?
No recurring cost. Except for AMC, CMC. So when you buy it, you have to haggle with them ki 2 saal ki AMC de. Uske baad to they'll charge some 2 lakhs rupees per year.
जो है उसका कोई depletion या कुछ?
Kuch. Except this disposable.
And that's the third
And
passage.
different probes.
And now we go through the 4.
Then when you buy this machine, then you have to haggle with them to get kya recurrent laser probe recurrent cost of the machine.
I advise